Why are you constipated? The main causes and types of constipation. Today we are going to look at the main causes and types of constipation. First, I will explain the difference between spastic and atonic constipation, and then I will tell you about the 7 main types of constipation, as well as what medications, what conditions and diseases cause constipation. It will be very interesting. Constipation can be divided into 2 large groups, spastic and atonic. Spastic constipation occurs due to increased tone, that is, spasm of the intestinal wall. They develop mainly against the background of stress and mental anxiety, whereas GI diseases, including irritable bowel syndrome, peptic ulcer disease, colitis, and enterocolitis. Spastic constipation is usually accompanied by acute abdominal pain, increased gas formation and discomfort, heaviness in the abdomen, and a feeling of distension, irritability, nausea, sometimes decreased appetite. The feces in this type of constipation is usually in the form of individual hard lumps, so-called sheep or goat feces. Atonic constipation develops due to relaxation of the intestinal musculature when the general tone of the body is weakened after infectious diseases, when the function of the brain and spinal cord is impaired, with sedentary lifestyle, irregular meals, with insufficient intake of dietary fiber, etc. This type of constipation is more common in older and elderly patients. In atonic constipation as well as in spastic constipation, symptoms of heaviness in the abdomen and distension, nausea, increased gas formation and discomfort are noted. However, in atonic constipation, the volume of feces is usually very large, not sheepish, and abdominal pain is usually absent, unlike spastic constipation, in which there are sharp, severe abdominal pain in the type of spasms. Both atonic and spastic constipation can be caused by similar reasons. Therefore, let's look at another classification of constipation. Type 1. Alimentary constipation. When you eat refined foods, sweets, food with low fiber content and rich in proteins, when you drink little water, it leads to excessive drying and hardening of fecal masses. It makes it difficult to pass them through the intestine. Type 2. Neurogenic constipation. Many neurological and psychological diseases can lead to constipation, such as organic diseases of the spinal cord and brain, melancholia, hysteria, neurasthenia, depression, and others. Under the influence of fear, intestinal peristalsis increases Behr disease, and under the influence of anger, it slows down. Type 3. Inflammatory constipation. Constipation occurs with chronic colitis, inflammation of the mucous membrane of the rectum, with fissures, fistulas of the anus, hemorrhoidal nodes, as well as with cystitis, prostatitis, perimetritis, and other inflammatory diseases of the pelvic organs. Inflammation in the large intestine causes constipation, and fecal retention supports the inflammatory process in the intestines. A vicious circle develops. Type 4. Mechanical or organic constipation can be caused by various kinds of scars, tumors, narrowing of the intestine, fecal and gallstones. In women, displacement of the uterus downward and backward, cysts and tumors of the female genital organs. Type 5. Toxic constipation occurs on the basis of lead poisoning, sometimes in artists with excessive application of makeup, intoxication with morphine, cocaine, benzene, sulfur. With prolonged use of laxatives can also develop constipation. A combination of toxic and mechanical types of constipation is observed with massive parasitosis, ascariasis, amoebiasis, and enterobiasis. Type 6. Endocrine constipation. In the occurrence of endocrine constipation, an important role is played by hormones of the ovaries, thyroid gland, pituitary gland, adrenal glands. In particular, with diabetes mellitus and hypothyroidism, patients often have constipation. The 7th type is medication-induced constipation. Constipation is listed as a side effect in the instruction for many medications. Which drugs and supplements can slow peristalsis and cause constipation? Antidepressants, antipsychotics, sedatives, iron-containing medications, diuretics, aluminum-containing, anti-inflammatory. If you have been prescribed a medication that has caused you constipation, you should not discontinue the medication on your own. Consume more fluids and fiber and ask your doctor for an alternative medication with less severe side effects or a gentle laxative. In the previous video, I analyzed what constipation is and what are their dangers. And in the next video, I will name the most common and not obvious cause of constipation. Take care of yourself and your bowels. Your Dr. Zarifa Romanova.